There is a plea for help from the very people dedicated to helping us.
Yeah, we're talking about EMTs and paramedics. They're the very first that show up on the scene when called when there's a medical emergency, when you call 911. They say now they're answering more calls than ever before, but in doing so, they are dealing with a serious problem.
Dustin Grove takes a look tonight at the growing shortage of EMS workers and what communities are doing to make sure there is help when you need it.
Ever since the first ride out, I knew that I wanted to do it, you know.
As an EMT for 10 years, Nick Schenk goes to work every day to save lives.
It's something that I just enjoyed from the beginning, so I don't see myself doing anything else.
Unfortunately, emergency medical services across the state say too many others are choosing to do something else. As ambulance crews respond to an increasing number of calls,
An ambulance. What's the address?
for 911 and to transfer patients from one hospital to another, the number of medics to get them there continues to drop.
How serious of a problem is this?
Well, I may be a little biased because I'm a paramedic and I'm in it every day. But, you know, everybody thinks their crisis is the most important one. But at the end of the day, our crisis means lives. And I think that's pretty important.
Ambulance calls up 44% over the last 3 years. Meanwhile, a decline in the number of EMTs and medics and an 11% drop in available ambulances for emergency calls. So what's to blame? Industry veterans point to historically low pay and burnout made worse since the pandemic.
And if you look at the staff now, just to keep ambulances running, paramedics are working, 3, 4, 5 days in a row sometimes, and they don't get to see their families for that time. And eventually that stress builds up.
Indianapolis EMS recently approved a 15% across-the-board raise for all of its medics and operates its own school for anyone interested in exploring the field. And the Boone County EMS also holds EMT school to recruit medics here at the hospital. In fact, about 30% of the workers here are graduates. Boone County's EMS is fully staffed today, but the director told us staying there has never been tougher. For Nick Schenk, the career is a calling he continues to answer. He and his colleagues hope others will too.
It's not always about the money. It's about loving what you do and enjoying it. I enjoy every day that I come to work.
The pandemic certainly has put a strain on all healthcare workers. For example, local health departments are responsible for so many additional duties right now in the pandemic, like COVID-19 testing that once again is in high demand. And there certainly is frustration among the workers who believe much of the extra burden of this care could be avoided if simply more and more people would go get vaccinated.
Overwhelmed might be an understatement depending on when you ask the question over the last 18 months. Obviously, as waves come and recede and come again, that's taxing. The other thing that is taxing for our local health departments and nurses, nurse assistants, doctors, and this is a frustration as well.
The governor made those remarks this morning while announcing the formation of a new public health commission. This panel is set to review the state system of delivering health care services.